The DL Lift, a targeted reinflation of facial fat pads using Belotero Intense. Fat pads within the face are distinct contiguous compartments, with their fibrous walls contributing to the superficial muscular aponeurotic system, or the SMAS. The lateral compartments are less mobile, being more deeply fixated than the medial compartments. Atrophy of the lateral fat pads can manifest as ptosis of medial fat pads, commonly referred to as the jowls. It's been documented that the various fat pads atrophy at different stages in life. The periorbital and malar fat pads tend to be affected first in life, followed by the temporal fat pads and the lateral cheek fat pads. Their atrophy results in loss of tension within the SMAS, which then manifests as the ptosis of the other fat pads, particularly in the superficial middle cheek fat pad, which does not atrophy very much throughout life. This gives rise to the jowls. The targeted reinflation of facial fat pads can be divided into 6 steps, or 6 regions, in this sequence. The first region is the superficial temporal fat pad. The second is the lateral cheek fat pad, followed by the deep malar fat pad and SUF. The inferolateral orbital rim and zygomatic arch, or region 5, tend to be affected later in life. Region 5 is the only area that is not a defined fat pad. The last region is the superficial labiomandibular fat compartment. The jowls are highlighted in white and should not be injected. The first injection is into the superficial temporal fat pad. Make the insertion in the skin over the zygomatic arch using a 23-gauge needle. Then insert the 25-gauge cannula and advance the cannula to the temporal region. The depth of injection should be in the superficial temporal fat pad. The cannula should be moved gently to avoid puncturing the superficial temporal artery. Slowly deposit Belotero Intense using the retrograde linear threading method. Attempt to spread the filler as laterally as possible. Remember, the intention here is not to fill the temporal hollow, but to tense up the superficial temporal fat pad. The recommended volume of injection on this area is 0.3 to 0.5 milliliter. The second injection point targets the lateral cheek fat pad. Using the insertion point from the first injection point, direct the cannula laterally and inferiorly, targeting the lateral cheek fat pad. Then deposit Belotero Intense using the retrograde linear threading method, again spreading the filler as laterally as possible. Spread the filler evenly throughout the superficial lateral cheek fat compartment. A significant vector of pull on the jowls will be observed when adequate filler material is delivered and this fat pad tenses up. The recommended volume of injection in this area is 0.5 to 0.7 milliliter. The target area for the third injection point is the malar fat pad. Make an insertion point using a 23-gauge needle in the mid-cheek. From the insertion point, advance a 25-gauge cannula to the malar fat pad. This is the third injection area. Deliver Belotero Intense in the malar fat pad using the retrograde linear threading. Be careful not to traumatize the infraorbital vessels when injecting the filler. The recommended volume over here is 0.5 to 1.0 milliliter. The target area for the fourth injection point is the suborbicularis oculi fat pad, or tear trough area. Using the same insertion point, advance a 27-gauge cannula deep to the suborbicularis oculi fat, SUF, and inject threads of Belotero Soft into the infraorbital area. Alternatively, Belotero Balance can be used in this region. The range of injection volume is between 0.1 to 0.3 milliliters in the SOOF. This injection creates support and takes away hollowness in the lid-cheek junction. For the fifth injection point, reinsert a 25-gauge cannula through the insertion point in the mid-cheek into the supraperiosteal plane, advancing to the zygomatic arch and lateral orbital rim. This is the only injection point that is not targeting a distinct fat compartment. The filler is deposited above the bone. Deposit Belotero Intense using linear threading with the cannula running tangentially to the zygomatic arch and the inferolateral orbital rim. These areas undergo resorption with age, and placing fillers here restores support to the face. The recommended volume of injection in this area is 0.2 to 0.4 milliliter. Make an insertion point using a 23-gauge needle in the midpoint of the chin. Insert the cannula and advance the cannula to the pre-jowl sulcus. The target area plane for this injection area is the superficial labiomandibular fat compartment. Deposit threads of Belotero Intense in this area. Tension in this area has a suspension effect of the adjacent jowls. The primary intention over this injection area is not so much to project or lengthen the chin, but to suspend the jowl better. This injection area is optional and recommended for those with more severe jowling. The recommended volume of injection in this area is 0.3 to 1 milliliter. This is the before picture and the 1-week post-injection picture after the initial swelling has subsided. The 1 grade improvement on the MERS jowl scale demonstrates the high lifting capacity of Belotero Intense. For this demonstration, we looked only at the effects on the jowls, as lifting on this area is easy to objectively quantify. However, as you can see, improvements can also be seen in the infraorbital hollows, nasolabial folds, marionette lines, as well as cheek volume. This concludes the demonstration on the DL lift, which is a targeted reinflation of the facial fat compartments to produce a lifting effect on the SMAS.